I want you to stop whatever you are doing right now and give me your full attention. Because what I am about to share with you in the next 10 minutes is something that could completely change how you take your vitamins and possibly explain symptoms you have been blaming on old age for years. Here is what I want you to picture. It is 7 in the morning. A 68-year-old woman named Margaret wakes up, walks to her kitchen, opens her supplement cabinet, lines up 6 different vitamin bottles on the counter, fills a glass of water, and swallows them all at once. Every single one. Right there, together, in one big gulp. She feels responsible. She feels like she is taking charge of her health. And she has been doing this faithfully every morning for 4 years. But here is what Margaret does not know. Some of those vitamins she is swallowing together are canceling each other out. Some are robbing her body of nutrients she desperately needs. And at least one combination she takes every single morning is silently contributing to the fatigue, the brain fog, the poor sleep, and the muscle cramps she has been chalking up entirely to her age. Margaret is not unusual. Margaret is the story of tens of millions of seniors right now. And her story does not have to be yours. I am Doctor, and today I am going to walk you through the 5 most dangerous vitamin combinations that seniors over 60 must never take at the same time. I will tell you exactly what happens inside your body when you make these mistakes, and exactly what to do instead. Stay with me through all 10 minutes, because the last combination is the one that surprises people the most, and the one most frequently mistaken for early dementia. You do not want to miss it. Why after 60 changes everything. Before the 5 combinations, you need to understand why age 60 is such a critical turning point with supplements. After 60, your kidneys work more slowly. They take longer to filter and clear out excess vitamins, especially fat-soluble ones like A, D, E, and K, which build up in your body, fat and liver, instead of flushing out in your urine. What was a safe dose at 40 can become a toxic accumulation at 65. Your stomach also produces significantly less acid after 60, and stomach acid is what breaks down supplements so your intestines can absorb them properly. Less acid means less absorption, and your intestinal lining becomes less efficient, turning your gut into a competitive battlefield where multiple vitamins fight for limited absorption capacity, and only the strongest ones win. Add the fact that most seniors are on at least 1 prescription medication, and the picture becomes genuinely complex. This is why after 60, the most important supplement question is not which vitamins to take. It is when to take them, and what must never be taken together. Now let us answer that. Combination number 1, calcium and iron. Calcium and iron is the single most common supplement mistake I see seniors making. Both minerals need to be absorbed in your small intestine, and calcium physically blocks the pathway that iron uses to cross into your bloodstream. Clinical studies show that taking as little as 300 milligrams of calcium alongside iron reduces iron absorption by up to 60%. 60% of the iron you are swallowing is blocked before your blood ever sees it, simply because calcium is present at the same time. For a senior woman who has been doing this every morning for years, the result is chronic low iron, and low iron means persistent fatigue, weakness, brain fog, and a weakened immune system. She thinks it is age. It may simply be the way she is timing her supplements. The fix is simple. Take iron in the morning on an empty stomach, ideally with a small glass of orange juice, because vitamin C actually improves iron absorption. Take calcium in the evening with dinner. Separate them by at least 2 hours. That one change alone can be transformative. Combination number 2, zinc and copper. Zinc and copper is quieter, slower, and in many ways more dangerous than the first combination, because it creeps up on you over months before you realize something is seriously wrong. Zinc supports your immune system, wound healing, and brain function after 60. It is a genuinely valuable supplement. But here is what almost nobody tells you. Zinc and copper compete for the exact same absorption pathway in your intestines, and zinc, especially at higher doses, always wins. This means that if you take zinc regularly without supplementing copper, zinc is slowly and steadily draining your copper levels day by day. Low copper causes neurological damage, tingling and numbness in the hands and feet, balance problems, muscle weakness, and in severe cases, a full neurological syndrome so similar to multiple sclerosis that patients have gone through extensive MS testing before a doctor finally checked their copper levels and found the real answer. The condition is called zinc-induced copper deficiency myelopathy, and it is almost entirely preventable. The fix is this: if you take zinc supplements, always pair it with a small copper supplement, no more than 2 milligrams of copper per day, and never take more than 40 milligrams of zinc daily. That is the safe upper limit for adults. Combination number 3, high-dose vitamin E and vitamin K. If you are on any blood-thinning medication, warfarin, aspirin, or any anticoagulant, pay very close attention to this one. Vitamin E taken at doses above 400 international units per day acts as a natural blood thinner. It reduces the stickiness of your platelets, the blood cells responsible for forming clots and stopping bleeding. Vitamin K, on the other hand, is required for your liver to produce the clotting factors that regulate how your blood clots in the first place. Taken together at high doses, these two vitamins create an unpredictable tug-of-war with your blood's clotting ability. And if you are already on a blood-thinning prescription drug on top of this, the consequences become genuinely dangerous. A minor cut that will not stop bleeding, a bruise from a small bump that spreads far more than it should, a fall that causes internal bleeding your blood cannot control properly. The fix is clear. Keep vitamin E below 200 international units daily, unless your doctor has specifically prescribed more. And if you take any blood thinner, tell your doctor about every single supplement you take, including vitamin E and vitamin K, before continuing. Combination number 4, magnesium and calcium taken together. Magnesium and calcium do not destroy each other the way calcium destroys iron absorption, but they compete so aggressively for absorption that taking them together severely reduces the benefit of both. And this matters enormously, because magnesium deficiency in seniors is already at epidemic levels. Over 70% of adults over 60 are not meeting their daily magnesium requirement, and uncorrected magnesium deficiency causes poor sleep, persistent muscle cramps, elevated blood pressure, anxiety, constipation, and a significantly increased risk of cardiac arrhythmia, an irregular heartbeat. These are not minor inconveniences. Calcium and magnesium are absorbed in the same section of the small intestine through similar transporter mechanisms. Taken together, calcium dominates. Magnesium is left behind. So the senior who is already deficient in magnesium, taking a magnesium supplement to fix that deficiency, may be undermining that supplement every single morning without knowing it. The fix is easy and worth remembering forever. Take calcium with your lunch or dinner. take magnesium at night, about an hour before bed. Not only does this eliminate the competition, but magnesium taken at night relaxes your nervous system, improves your sleep quality, and prevents those painful nighttime leg cramps. Many of my patients notice a difference in their sleep within 1 week of making this single change. Combination number 5, high-dose vitamin C and vitamin B12. Here is the combination that surprises people the most. Vitamin C and vitamin B12 are two of the most innocent-sounding, universally recommended supplements for seniors. But take them together at high doses, and you may be doing real harm to your brain and your nervous system. When you take vitamin C at doses above 1,000 milligrams, it creates a highly acidic and oxidative environment in your digestive system. That same oxidative chemistry that makes vitamin C such a powerful antioxidant in your tissues actually degrades vitamin B12 in your gut before your intestines can absorb it. Research published in the American Journal of Clinical Nutrition confirmed that high-dose vitamin C significantly reduces the amount of B12 your body can absorb from a supplement taken at the same time. Now here is why this is so dangerous for seniors specifically. B12 absorption is already severely compromised in many people over 60 because the stomach produces less intrinsic factor, a protein essential for B12 absorption as we age. If your B12 absorption is already struggling, and then vitamin C is degrading a portion of what remains, the result over months and years is progressive, worsening vitamin B12 deficiency. And B12 deficiency in a senior does not look like a simple nutrition gap. It looks like early dementia, memory loss, confusion, depression, difficulty concentrating, tingling in the hands and feet as the nerve sheaths deteriorate without bile to maintain them, balance problems, profound fatigue. Families watch their loved ones develop these symptoms and believe they are watching the beginning of an irreversible decline. But when the true cause is B12 deficiency, these symptoms can be partially or fully reversed when caught in time. I have seen it happen with my own patients. The fix is this: take your vitamin B12 in the morning. Take your vitamin C in the afternoon or with lunch. Keep them separated by at least 4 hours. Better yet, switch to sublingual B12, a tablet that dissolves under the tongue and bypasses the gut entirely, completely eliminating the vitamin C interaction. And be cautious about taking vitamin C above 500 milligrams. Your body can only absorb about 200 milligrams at a time anyway. More is not always better. Let me bring everything together before I let you go. Combination number 1, calcium and iron, never together. Take iron in the morning, calcium in the evening. Combination number 2, zinc and copper. Zinc drains copper silently over time. Always pair your zinc with 2 milligrams of copper daily. Combination number 3, high-dose vitamin E and vitamin K. Dangerous for blood clotting, especially with blood-thinning medication. Keep vitamin E below 200 international units unless medically directed otherwise. Combination number 4, magnesium and calcium at the same time. Take calcium with meals and magnesium at night before bed. Your sleep and your muscles will thank you. Combination number 5, high-dose vitamin C and vitamin B12. They fight in your gut, and B12 loses. Take them separately, or switch to sublingual B12 and eliminate the problem entirely. Your vitamins are not harmless just because they are natural. They are powerful compounds that interact with each other and with your medications in very real, very specific ways. You do not need to stop taking your supplements. You simply need to be smarter and more intentional about how and when you take them. Write these 5 combinations down Tape them to your medicine cabinet. Share this with someone you love. Show it to your doctor, because the most dangerous thing about these interactions is not that they are complicated. The most dangerous thing is that they are invisible. Everything seems fine on the surface, and all the while, quietly, your body is working against itself because of a mistake that can be fixed in 5 minutes. Now you know. Use that knowledge to protect yourself. I am Doctor, and I will see you in the next talk. Take very good care of yourselves.